afternoon, all of you. Welcome, one and all. Sorry for the delay. So today we are running out of time. So directly we'll start the program. Our co-chair and keynote speaker is waiting. Getting recognized globally. So we need to come. So for that we are here. First, I would like to call upon stage Dr. Rajeshwar Rao sir, our co-chairperson. Please welcome, sir. Yes. Extremely sorry for the delay. Please have a seat, sir. Our next dignitary is Dr. Anurag Pandey, sir, from BHU. He will be a keynote speaker. Please welcome, sir. He has helped a lot in our computer system also. Thanks a lot, sir. And so first, after that, Anurag Pandey sir will have a keynote speech here. Sir, your timing will be 15 minutes. So please try to conclude in that time. Thank you, sir. Please advertise.
Very good afternoon, one and all presented over here. Myself, Dr. Anurag Pandey. I am assistant professor in Great Banaras Hindu University. There is a faculty of Ayurveda, Institute of Medical Science, working together in one roof, and I am working there since 2015. So, on behalf of the organizing committee, I cordially welcome you all presented over here, because the session is going little bit late and some sort of arrangement. But कोई बात नहीं, ऐसा होता है. This is the future of advancement. और हमारे जो बच्चे हैं उनको टेक्नोक्रेट्स होना चाहिए. They must know how to operate all things. तो तभी एक आई बिलोंग्स टू बनारस यूनिवर्सिटी, और वहाँ के जो फाउंडर थे द ग्रेट विजनरी पर्सन भारत रत्न पंडित मदन मोहन मालवीय जी. तो उनका कहना था कि जो स्टूडेंट होते हैं उनका सर्वांगीण विकास होना चाहिए. चारित्रिक विकास के साथ, शैक्षणिक विकास के साथ में और भी इंटेलेक्चुअल प्रॉपर्टी और ये को करिकुलर एक्टिविटीज़ में भी उनको एक्टिव होना चाहिए. मुझे याद आया उनका बात, तो मैंने यहाँ पे रखा. अगेन रिस्पेक्टेड चेयरपर्सन और को चेयरपर्सन डॉक्टर राव सर और डॉक्टर सुरेंद्र शर्मा सर, जो भी शायद आने वाले हैं, हमारे कोऑर्डिनेटर डॉक्टर मैडम, और डियर स्टूडेंट्स एंड कलीग्स. Today I am going to discuss on doctrines of Ayurgenomics and precision medicine with special reference to CLEB, that is male infertility, clinico-etopathology and molecular genetic association correlative study. So here is a two-part. First one is doctrine of Ayurgenomics and precision medicine. So what is the meaning? This is the latest trending medical new thing in new advanced thing in medical technology, which is going to precise or very viral nowadays, because we are serving from A to Z, and precision medicine provoke from Z to A. So in American or developed countries, it's very trending nowadays, and in Ayurveda, we can collaborate with Ayurgenomics, or we have ample examples in Ayurvedic Samhitas, and we need to just collaborate. Second part is the clinico-etopathology and molecular genetic association correlative study, carried out under my supervision by Dr. Avinish Jaiswal. He is one of my first PG scholar. So, procreation is a biological process by which new offspring or individuals, organisms are produced from their parents, and recreation is an essential part of human's life. Basic of this, infertility is the main problem before the above two concepts, and it is categorized under the CLEB in Ayurvedic Samhitas. What is the Ayurgenomics? Ayurgenomics integrate concept in Ayurveda such as Prakriti with modern genetics, along with correlate with those or dhatu, just Bat, Pitta, Kafas, with particularly gene expression or a specific gene and physiological characteristic feature particularly. And it also helps to interpret Ayurveda as an ancient science or epigenetics, which assess the current state of dosas and under specific personalized medicines. So basically, precisional medicine and Ayurgenomics both are concentrated to the personalized medicine or P4 medicine. Therefore, they are similar. Precision medicine first introduced by American scientists in 2014, and American President Obama launched a huge expenditure to develop this clinical entity in 2014. और उसके बाद में लगातार इसमें एडवांसमेंट इतना हो रहा है कि इन डेवलप्ड कंट्री समहाउ दिस इज़ अ रैंडम टेक्निक टू डायग्नोज द प्रॉब्लम. And precision medicine, sometimes known as a personalized medicine, is an innovative approach to tailoring disease prevention and treatment that takes into the account different in people's gene, environment and lifestyle. So dear students, we have already discussed about the lifestyle, दिनचर्या, ऋतुचर्या, आहारचर्या, निद्राचर्या, है ना. और nowadays it is very trendy, food for mood, food for depression, food for diabetes, food for hypertension, food for infertility. What kind of the food we have to eat? अभी देख रहे हैं यहाँ पे, this is a milletier. मेरे बच्चे साथ में आए हुए हैं और वो देख रहे हैं पापा हर जगह मिलेट का कुछ ना कुछ है, केक भी है, पिज़्ज़ा, बर्गर है. देयर इज़ न्यूमरस डिशेस अवेलेबल इन द फॉर्म ऑफ मिलेट. तो ये आहार हमने क्यों बताया है, व्हाट इज़ द इम्पोर्टेंस ऑफ मिलेट और आयुर्वेदिक आहार इन पर्टिकुलरली इनफर्टिलिटी और जेनेटिक डिसऑर्डर, वी आर गोइंग टू डिस्कस. सो मेल इनफर्टिलिटी डिस्क्राइब्स इन आयुर्वेदा एज ए क्लेब, नपुंसकता, और मेन टर्म बिहाइंड दिस ग्रेट प्रॉब्लम इज रेतस परीक्षा. समहाउ दिस इज miscalculated or misprovoked by शुक्रदोषा or other, but that is not clear because the main biological process of shukra and retas is very much different. So 8 type of the physiochemical features for the diagnostic cause of male infertility is described in Ayurveda, that is phenylam tanuruksham cha, vivarnam puti pichalam, anya dhatu pasansrashtam, avasadi tathastamam. So ruksh, particularly ruksh and tanu is very much similar to genetic assessment of male infertility, rather is secondary. So basis of what is the current scenario of infertility in world or India. So WHO estimates that 60 to 80 million couples worldwide currently suffering from infertility. The data is very huge. Infertility varies across region of the world and is estimated to affect 13 to 15% of couples worldwide. इतने ज़्यादा लोग हैं जो अभी इससे इन्फेक्टेड सफ़र कर रहे हैं. 10 to 20% of all men have low sperm count because of the dietetic habits. This is the age of smoking. This is the age of depression. This is the age of anxiety, where we living under the one roof. और कोविड जैसे इन्फेक्शन ने हम सभी को परेशान किया है. तो ये इसके कारण प्रॉब्लम बहुत ज़्यादा है. 85% आर ट्रीटेड विथ कन्वेंशनल मेडिसिन और सर्जरी टू रिपेयर डिसीज रिप्रोडक्टिव ऑर्गन, but less than 5% of infertile couple attempts in vitro fertilization and cost is near about 2.5 lakh. Amount is very huge. All sufferer are not capable to invest such a huge amount. 2.5 लाख रुपए हर किसी की व्यक्ति and untolerable psychosomatic pain particularly for women. अगर किसी का इन्वेस्टिगेशन किया हो, अगर किसी हम लोग कर ही रहे होंगे, डॉक्टर बैठे हैं, और अगर इनफर्टाइल वुमेन का इन्वेस्टिगेशन अगर हम देखते हैं, so this is a big trauma, even as curse also in India. So cause of the infertility is near about anovulation is 10 to 20%, female tract goes to 30%, male tract goes to 40%, and still I have a very long problem with this term unexplained or idiopathic. हम लोग पढ़ा रहे हैं 20 साल से बच्चों को. In spite of time or advancement, we have a PCR, electron microscope, numerous investigation units हमारे बढ़ते ही चले जा रहे हैं. बट बुक में हमेशा लिखा रहता है 20% goes to idiopathic, 30% goes to unexplained. Why it is so? अगर हम इतना ज़्यादा टेक्नोलॉजी में प्रिसाइजली जा सकते हैं, दिन इसकी ज़रूरत क्या है? वी फेल टू डिटरमाइन फाइनल कॉज ऑफ मेल इवन दैट फीमेल इनफर्टिलिटी. सो मॉर्बिडिटीज ड्यू टू पुअर रेतस परीक्षा, रेतसिस अष्ट जो मैंने अभी बताया, इस तरीके से इसको कैटेगराइज किया जा सकता है. बट फाइनली एज पर द कंटेम्प्रेरी साइंस वी कैन कैटेगराइज इन 3 टाइप ऑफ द कॉज: प्री टेस्टिकुलर, टेस्टिकुलर एंड पोस्ट टेस्टिकुलर. So testicular cause particularly describes genetic agiospermia, oligospermia or environmental factor pertaining to the my topic, which where I go to concentrate or today I am going to discuss in my further slides. ये कुछ और एटॉल पैथोलॉजिकल डिटेल्स हैं यहाँ पे जो इस प्रॉब्लम में सपोर्ट करते हैं, जैसे डिफेक्टिव स्पर्मेटोजेनेसिस. इसका एक बहुत बड़ा कॉज आहारचर्या है. हमारे यहाँ आयुर्वेद में जो बताया गया है, बहुत सारे ऐसे द्रव्य बताए गए, आहार और विहार बताया गया है जो स्पर्मिसाइडल है. जस्ट लाइक स्मोकिंग और पुटिंग फोन इन जस्ट पॉकेट्स इन जीन्स और थाई, नियर द थाई. पहले इसके पहले बेल्ट पे आता था. और लैपटॉप को काम करना, ये दिस इज़ अ सिटी ऑफ टेक्नोलॉजी, हैदराबाद. तो इधर तो सबसे ज़्यादा प्रॉब्लम होना चाहिए. मुझे लगता है कि यहाँ पे भी रेडिएशन इफेक्ट ऑफ मेल इनफर्टिलिटी पे एक सर्वे स्टडी होना चाहिए कि कितना रेडिएशन इफेक्ट है. अधिकतर लोग इवनिंग में आप आराम से लेट करके और काम करते हैं, तो ये रेडिएशन का इफेक्ट बहुत मिलता है. ऑब्स्ट्रक्शन ऑफ द इफेक्ट efferent duct system, failure to deposit sperm high in the vagina, because we are not in our country sexual education is a taboo. ये हमारे syllabus का part नहीं है. So this is going on. And Ayurveda and epigenetics. This is very important slide. Epigenetics refers to the external modification of DNA that turns genes on and off, affecting gene expression, or particularly three main causes behind it: lifestyle and behavior, diet and digestion, stress and environmental factor. ये तीनों फैक्टर आयुर्वेद में बहुत क्लासिकली बहुत अच्छे तरीके से वर्णित हैं. आयुर्वेदा एड्रेस दीज फैक्टर्स देयर बाई acting on the deha prakriti, that is a genotype, and a janma prakriti as a phenotype. And we as a student of science, we can calculate the phenotype, or we can up and down in phenotype rather than genotype. So concept of genetics described in Ayurveda as a bij bhagavyab and bij bhag avayav. So adi balprabit or sahajvadis categorized under the genetic disease in Ayurveda, mentioned in different places in Samhitas. Figuratively, this is estimated that humans have approximately 20,000 genes, and nowadays, in spite of advancement, only 2% genes are coded or invented with a clinical trial. सोचिए कितना बड़ा डेटा है, इतनी हमारी एडवांसमेंट है, पर 2% ही है. जैसे अगर मेल इनफर्टिलिटी की मैं बात करता हूँ तो AZF, ER और SRY जीन आर पर्टिकुलरली ऑब्जर्व affecting male infertility, but many more have to come. अभी बहुत है जिस पर स्टडी होना बाकी है. The genotype refers to the part of the genetic makeup that determine a specific characteristic of an individual. It is subtle and non-changing unless there is toxic damage. इसमें डाइटेटिक फैक्टर के कारण डे बाई डे बहुत ज़्यादा अप एंड डाउन हो रहा है, जिसके कारण से प्रॉब्लम बढ़ता जा रहा है. अगर यहाँ पे मैं WHO का सीमेन एनालिसिस का क्राइटेरिया आपके सामने सबमिट करूँ, सो फर्स्ट में मॉर्फोलॉजिकल फीचर WHO ने मेंशन किया 86% sperm have to alive और प्रॉपर मॉर्फोलॉजी, देन 56, देन 36, और नाउ डेज जो 2011 में आया है उसमें केवल 11% मॉर्फोलॉजी नॉर्मल होना चाहिए मेल स्पर्मेटोजोआ की, दैट देन पीपल आर केपेबल टू. ये इतना कम होता जा रहा है क्यों? बेसिस ऑफ डाइटेटिक irregularities in our diet as well as bihar. So the phenotype refers to the physical properties of an individual's appearance, develop or behavior, whatever. Whenever one does it one's life, knowingly or unknowingly affect the phenotype and change in the expression of the genotype accordingly. So there is a three term: bij, bijaga bhag or bij bhag avayav. Bij is representing responsible for conception, bij bhag avayav is particularly responsible for tissue or organ development, and bij bhag avayav are particularly for manifestation in the individuals in the form of the character. Definition of genetics described in Ayurveda as well what is the contemporary science. A genetic disorder is a disease caused by abnormalities in genes or chromosomes. And what is the mutation? A state of heritable alteration in DNA affects the phenotype. And etiology, largely unknown environmental factor, radiation, viruses and channels, chemicals. So environmental factor is very much induced as well as provoked in described in Ayurveda, which is closely resembled to etiological factor of male infertility. The factor contributing in the prevalence of genotype described in Ayurveda are defect in Shukra or Shonita, Bij Bhagavyab or Bij Bhagavyab, Kal of conception and condition of uterus, dietetic regimen of the mother during pregnancy, presence of disease condition in parents or characteristic of Mahabhutas which comprising fetus. These are the exclusive factors which are responsible for gene disorder. So this is the some examples described in Samhita. स्किन डिसीज़ के बारे में, हेमोराइड्स, ब्लाइंडनेस, डमनेस और डिफनेस के बारे में आयुर्वेद में कई जगह आता है, और इसके कई रेफरेंसेस हमारे यहाँ अवेलेबल हैं विच आर रिलेटिवली क्लोजली रिलेटिव विथ जेनेटिक डिसऑर्डर्स. नेक्स्ट प्लीज. अच्छा, आप अलग से कर रहे हैं उधर से. ओके. सो द मेंटेनेंस ऑफ जीनो, इसमें एक और लास्ट में आता है यूजिंग द एडवांस अप्रोच ऑफ जीनोमिक्स, प्रोटियोमिक्स एंड अप्लाइंग द एडवांस जीन एक्सप्रेशन टेक्निक्स or microarray would help to interpret the causative mechanism for infertility. So we have a very excellent department of genetics in our institute called Banaras Hindu University. So वहाँ पे मैंने कुछ collaboration किया है. I'm working since 6 or 7 years. तो ये कुछ हम वहाँ पे काम कर रहे हैं. और what is the purpose of this study? To assess the determine the genetic predominance as well as the expression level of candidate gene concerning male infertility, particularly in eastern Uttar Pradesh. The present clinical trial has been conducted. The main objectives are to evaluate the genomic variation and extinction factor in the pathogenesis of male infertility, and to develop correlation between molecular genetic association and Ayurvedic etiopathogenesis. The present study has been carried out. इसमें we have known case of the male infertility, 24 patient in group A and 24 patient in group 2, randomly selected for the Prakriti, Shukra, subjective happiness scale, WHO, quality of life, serum testosterone, lipid profile, urine semen analysis, thyroid function test, along with the molecular assessment. What kind of the molecular assessment has been done? The candidate gene SRY, AZF and AR gene particularly were analyzed for DNA mutation in patient with infertility and controls. Genome DNA isolation and genotyping with performed by using PCR based techniques. This is a very trendy nowadays after the COVID. So method, the prospective randomized clinical study, total 48 cases will be divided in equally, randomly divided into two groups. Elect male patient suffering from infertility at least 1 year having a normal frequency of relationship and failed to achieve clinical pregnancy will be were included in our study. Control group were normal. Our sample technique was random type of the sampling selection selected in the to know the frequency of the male infertility in the given area. The DNA extraction was done following the PCR and gel electroporation and DNA sequencing performed. Sample collected from blood, not for semen, because this work can be done by the semen also or blood also. So this is the primer designing of the all three gene, PCR and SRY and AZF gene. This is the distribution of the patient according to the microdeletion in AZF gene. So in this clinical study, 62.5% of the subject had microdeletion in AZF gene. This is very significant group, in particularly A group, which is infertile group. Second is distribution of patient according to the deletion of SRY gene. The group A, 6 patients have reported mutation of SRY gene out of 24. This is 25%. And distribution of patient according to the deletion of AR gene. This is in group A, 4 patients have mutation in AR gene and 20% do not have any mutation in AR gene percentage. So इसका मतलब ये है कि जो सबसे ज़्यादा हमें फर्स्ट में मिल रहा है, AZF gene is more responsible अगर हम कंपेरिजन करें इन तीनों का फॉर मेल इनफर्टिलिटी रेदर देन SRY एंड AR gene. मेरे यहाँ पे दो ग्रुप सेलेक्ट किए थे, ए ग्रुप और बी ग्रुप, बट हियर आई एम प्रेजेंटिंग ओनली डेटा ऑफ ए ग्रुप. बी ग्रुप इज अ नॉर्मल, बट दिस वर्क इज IPR प्रोटेक्टेड. आई हैव सबमिटेड इन प्रोजेक्ट फॉर ICMR DST एंड फर्दर स्टडी इज गोइंग ऑन इन सेकेंड ग्रुप. एक और दूसरा स्टूडेंट आया है, उसको इसके आगे की स्टडी दी है, इसलिए यहाँ पे एक स्मॉल डेटा ही आपके सामने मैं रख रहा हूँ. So result reveals that there was a significant correlation between the genotype of the exon S by 69, exon Y89 and numerous. Consequently, in SRY and AR gene, mutation and microdeletion was analyzed. So AZF का देख रहे हैं, इसमें सबसे ज़्यादा हमको correlation देखने को मिला. First में the significant correlation were measured in the cases of infertility on Ayurvedic parameter like Prakriti, Shukra, testosterone, urine, semen analysis was observed. ये इतने सारे टॉपिक थे जिनको हमने कोरिलेट किया, बट टाइम की वजह से यहाँ पे उन स्लाइड को मैं नहीं दिखा पा रहा हूँ क्योंकि आई हैव ओनली 15 मिनट्स एंड माई टाइम इज नियर टू गो. डिस्कशन देयरफॉर द रिजल्ट ऑफ सच टाइप ऑफ द म्यूटेशन इज हार्मफुल एंड नॉट एट ऑल फेवर फॉर द cell as a unit of perform the function. When mutation take place, it alter the protein which may play an important role to perform the function, result in a serious medical condition or termed as a genetic disorder. तो इस कंडीशन में all three genes mutation responsible for the development of testes and regulation for the spermatogenesis. Hence, genotypic correlation of Ayurvedic birth prakriti and the phenotypic correlation of Ayurvedic deha prakriti. Disturbance in the deha prakriti is known as a vikriti in Ayurveda, which correlate with disorder and disease in the current medical system. So, this is the conclusion of this clinical work. Is the result of the study suggested a significant statistical association between said three genes along with prakriti, Shukra, Shar, serum testosterone and semen analysis. And why microdeletion, AZF gene mutation, SRY gene mutation and AR androgen receptor gene mutation is the main genetic cause of the etiopathogenesis of male infertility, and male infertility is a complex and multifactorial disorder along with genetic cause. Take home message: it is important that all couple undergoing infertility treatment should be informed for the risk, benefit and possible outcome through the use of genetic testing and counseling. As more genes are discovered and the etiology of infertility disorders become better understood, the management and treatment of infertility will improve as well. Diet management should be suggested is very important. Thank you.
in 2019 in the Nepal. So please give him a big applause for that. So we will directly start with the presentations. So first, here presenting Shravani Damalagunta. Her topic is Conceptual Understanding and Clinical Application of Pradhamanasya. Shravani, please. So please ma'am, her topic is Application of Principle of Rukshan in Management of Obesity.
I welcome the co-chairperson and chairperson, Dr. Rao sir, ma'am, and Dr. Anurag Pandey sir. Today I will be presenting on the topic a critical review of pharmacodynamics of Udvartan with a special reference to obesity. No one being in Ayurveda will be ever to deny that Udvartan helps in obesity, but never it has been defined how it works. What is the mode of action that Udvartan is acting on obesity to reduce the weight and many other parameters, biochemical parameters also. So here I have tried to come up with the receptor and the target values where Udvartan is working, and it helps to reduce obesity. Next slide please. Obesity, again, this is something which is a compilation sort of thing. Obesity results from the pathogenic changes virtually in every organ system, which is the leading cause of mortality and morbidity in India and worldwide also. It has been discussed under the Athisthalle, which is the excess accumulation of fat or the maida and mass, leading to flabbiness of the hips, abdomen and breast. It is considered as one of the Santarpan Jana Vyadhis in Ayurveda. Meda Dushti is one of the risk factors for ischemic heart disease also. And that is why this therapy is becoming a very popular thing now, because India itself is going to be a cardiac disease capital in the coming years. And already world has nothing very good for the cardiac patients to offer. Next one. Line of treatment of obesity, as it is a whole that matters. Shamana, Langana, Amapachan, Rukshudvartan, which will be my topic. Heavy and non-nourishing diet, physical exercises, Shamshodhan Chikitsa, Panchakarma, including the Vamana Virachan, it is wise for the management of sthala. Next please. Now we come to the main topic, Udvartana. It is the procedure of massaging the whole body below the neck in the direction opposite to the orientation of hairs. I'm sorry I could not decode this one, why it is opposite to the direction of hairs during all my research in this work. With some pressures, this massage is done with applying some pressure. Udvartana is a special type of abhyanga with herbal powders are used for massaging. Sometimes oils may be added or it may not be added. It is that is why it can be categorized into two types, Snigdha and Ruksh. Snigdha means which is oily, which has oil in it also along with the powder, and Ruksh means which doesn't has a oil mixed with it. Next please. The procedure is the method. It is an application of medicated oil is indicated and dusting of the herbal powder on the body, followed by massage with some pressure in the direction opposite to the hairs. It is the main method. And then before this main procedure, a preparation of the patient is done. And the ideal time for the Udvartan is in morning hours after the evacuation of the bowel and bladder. It should be performed empty stomach. This is important. And before bath. Mild exercise may be advised to the patient before the procedure. Next slide please. This is the main procedure which I told you. These are the some parts. We have to do the massage with the powder in a sitting upright position, then in the supine, then in the lying lateral left, then in the prone, and then lying lateral right, supine, and then again sitting upward right. Next please. After this procedure is done, we ask the patient to wipe up the body with a dry and a clean towel, leaving the thin film of oil is also good. Ask the patient to rest for at least 30 minutes to 1 hour and have a warm shower afterwards. A steam bath is beneficial at this stage. Next please. This is what is told in Ayurveda itself. It is kapha-hara, means it decreases the kapha, or it destroys the morbid kapha in the body. Vata-haram, it destroys morbid vata. Med pravilanam. It liquefies and metabolizes the stagnant morbid fat. That is a very important thing, and even many of the modern research works are being done on this clause, how it liquefies or mobilizes the fat. It provides the stability to the body, it rejuvenates the skin. Dorgandhe haranam, it elevates the foul smell of the body. Gauravam haram, it elevates heaviness of the body. Next slide, please. Tandra haram, mal haram, sweda haram. It means it helps to purify the body. It helps in the purification. It is a sort of external purification which could be done. There are many procedures in Ayurveda which are mentioned as internal and external purification, and this procedure specifically is a part of external purification. Next one, it helps to open the blocked channel which is mentioned as Shira Mukh Vivaktam. Means it helps to open the blocked channels, blood vessels, transport systems of the body, and enables the free circulation of nutrients and essentials in the body. So Agni Samanikaram. In Ayurveda we say that, we mentioned that there is a Bhrajak Agni in the skin in the form of Bhrajak Pitta, and it is responsible for the skin immunity, good color and complexion. Then it provides kanti to the person, good shine and complexion, and sharir parimanjan, that is, it cleanses the body. Next slide, please. So as I said, it has a lot of functions which are mentioned in Ayurveda. We take up one by one. First one is the fat deposition, how it liquefies the fats. So before understanding the methodology of fat liquefaction, we have to understand what is the physiology of fat deposition in the body. And very brief, this is a very broad literature in physiology. If you see, I have taken out the very brief points so that I may able to make you understand. So this is the basic fat deposition in our body, that is superficial and deep abdominal subcutaneous fat. Then there is intra-abdominal fat, which includes mental and mesenteric deposits. Then the third important segment is the lower body fat, which is coordinated to inguinal ligament anteriorly and iliac crest posteriorly. Subcutaneous lower body fats is a major fat deposition. It includes the gluteal and the leg deposits. Upper body subcutaneous fats includes the superficial and deep, truncal noted previously, upper extremity fat and breast adipose tissues in the woman. Next. Then there is a two type of classification of the fat as per the modern physiology, which is brown and the white fat. Brown fat has a location as you can see in the figure also, and white fat which stores more than 95% of the total lipids as neutral lipids, triglyceride, and release them as free fatty acid and glycerol in highly regulated fashion involving multiple hormone, enzymes and protein. So you can see this is the brown fat location, and then this is all I mentioned where are the fats deposit, major fat deposits in the body. Next slide please. So what is the function of these fat deposits in the body? Adipocytes, which is the fat cells, produce several hormones including the leptin and adiponectin, which modulate your appetite, fuel metabolism, immune function, reproduction. Adipocytes also secrete complement and acute phase response protein, including serum amyloid A, which can influence the systemic inflammation and insulin resistance. Here comes the key. So adipose tissue or the adipose fat has a direct link to the insulin metabolism and immunity, fuel metabolism. Next. So when we say it helps to liquefy the Meda Dhatu, in Ayurveda we are trying to say because of friction, every friction produces Ushma, Agni. So when we get into this friction of the powder massage, there is an increase in Ushma, and this increase in Ushma in the body helps to correct the lower Agni in your body. And all the 11 Agnis are interrelated in our body, which is mentioned in Ayurveda. In modern references, what I searched, it mentions that there are 13 biological processes were significantly altered by mechanical massage, and 6 were closely related to metabolism and significantly enriched. That means a massage system helps to redefine your metabolism state. Next slide, please. Just this one is basic important. Blunted sympathetic nervous system response to energy intake have been observed in obese patients. obese patient doesn't have a good sympathetic response as mentioned in the modern researchers with metabolic syndrome and insulin resistance. So this massage with the Udvartan helps to modify your sympathetic nervous system, and there is beta 2 androreceptors in the dominant lipolytic receptors in human white adipose tissue, and these are stimulated by the massage, so they help to increase the metabolic rate in the human, in the patient. Similarly, there are so many beta receptors, and every beta receptors had a different functions as mentioned here. Next slide, please. See, this I have shown Ushnavir. The drugs which are used in Udvartan are normally Ushnavir. They will increase the pitta because Gun Sadharma is there, and then in turn they will increase the Agni, and it will help to decrease the Kapha and Meda. If we go into this system of pitta is representing here the sympathetic response. Increase in beta energetic sensitivity in adipose tissue of the subcutaneous fat will help in the lipolysis, and this will release free fatty acids, and this will go to the liver and they help in the secretion of bile. So you can see there is a direct correlation of increased pitta and increased bile as per the modern medicine. Thank you. Conclusion, please. There has been no research, it is just the correlation I have tried to make. Thank you. Thank you for the patience hearing.
Nice presentation, ma'am. Our next presenter is Ashavani. Is it ready? Should I try? Application of principle of Rukshana in management of obesity. Say, okay.
From Department of Panchkarma. Next slide. Excessive accumulation of subcutaneous fat, which is leading to health problems such as diabetes, hypertension, high blood pressure, and cancer. Mainly the etiological factors are sedentary lifestyle, lack of exercise, faulty food habits, urbanization, and psychological factors. Mainly the prevalence of obesity in India is more than 135 million individuals. And in that, among central obesity is mainly affected. It is 16.9% to 36.3%. Women are more affected than men. So, abdominal obesity is one of the major risk factor for cardiovascular diseases. Mainly, according to Ayurveda, Guru and Snigdha Ahara, Avyayama, Diva Swapna, these are the main factors for Sthaulya. So, Sthaulya Roga comes in Ayurveda under category of Kapha Pradoshaja, Medo Pradoshaja, Bahudosha Avastha, and Santarbana Janya Vyadhi, and it is a predominant metabolic disorder which is mentioned by Charaka in Ashtanindita Purushadhyaya. So, causes of obesity are overeating, medication, inactiveness, lack of sleep, and these are the complications. Metabolic syndrome, which is one of the main complication, and in that, according to WHO, general population BMI classification is different and Asian classification is different. In that, overweight is 23 to 27.5 and obese is more than 27.5 in Asian Indian classification of BMI. And mainly here, because of the blockage of the Shrotasis by Meda, there is increase of Samana Vayu, which is increasing, which is leading to aggravation of Agni, causing more, leads to rapid digestion of consumed food and leaves the person craving for more food, which is in turn leading to Sthaulya. So, person becomes voracious eater and vicious circle, creating excessively improperly formed Medodhatu. So, because of that, Shrotorodha leading to improper nourishment of the other dhatus, causing Shaitilya of dhatus prior to Medodhatu and depletion of the dhatus next to Medodhatus. Next slide. So, what is the purpose of the study? Mainly because of the urbanization and non-communicable diseases are increasing more in the past over 3 decades and decrease in the trend of communicable diseases. Mainly first approved FDA drugs are phentermine and diethylpropine, which are mainly used for weight loss, but they also have some side effects. So, here Here we need to explore and witness the effectiveness of principle of Rukshana in the management of obesity. So design of the study, Rukshana we are taking Madhudaka, Takrapana, Haritaki Churna, Udvartana and Lekhanavasti, which is done for 60 days. So Madhu, which is given on empty stomach with normal water, and Thakra, which is given 200 ml after lunch, and Haritaki Churna we are giving 4 grams with lukewarm water at bedtime. And Udvartana with Kolakulutadi Churna we are doing for 15 days and with a gap of 7 days for around 45 minutes. And Lekhanavasti after giving gap after Udvartana we are doing lastly Lekhanavasti. So intervention. Why Madhudaka means? According to Chakradatta, he mentioned Prataha Madhuyutam Vari Sevitam Sthaulyanashana. So, and next, what are the properties of Madhu? It is Grahi and Lekhana, which is helpful in respiratory disorders and cholesterol depositions in blood vessels, which have Madhu have the properties Madhurarasa, Kashaya Anurasa, Agni Deepana, Laghu and Shodhana, and Medohara property mainly it has. And Takra. Takra is a Shroto, has a property of Shroto, Vishodhana and Deepana Guna, which in turn causes Chedana of Kapha, and it is told as regular use of Takra prevents Santarpanajanya Rogas. And Udvartana, because of its dominance in Rukshana Guna, which helps to decrease the Kledatva in the Sharira. And Ushna Jala Pana also, which is mentioned by Charaka, Sneha Jirna Jarayati, Sleshmanam Tad Bhinnati, which means it helps in digestion of undigested fat and it disintegrates kapha. And Haritaki Churna, one of the main indication of Haritaki Churna is Shroto Vibhandan Vividan Pralepam, which means it scrapes or it has a Lekhana property where collection of adhesive material like fat around the heart, it will help to remove that. And Lekhana Vasti, the ingredients are Trifala Kvata, Gomutra, Ushakadi Prativapa Dravyas as Saindava, Shilajit, Kasisa, Hingu and Tutta. And all these properties have Ushna, Khatu, Tikshna, Kafahara properties. And Kalkadravyas here we are taking as Musta, Trifala and Shatapushpa. Mainly they have Vata Kapha property. And these are some of the interventions. Efficacy of Lekhanavasti in management of Sthaulya, management of Sthaulya with Apatarpana Chikitsa, which is a single case study, and different forms of Rukshana Karma in metabolic disorders. And result. And this is because of predominance of Katu Tikta Kashaya Rasa. Mainly Rukshana has a property, Rukshana drugs have property, should have Katu Tikta Kashaya, Laghu, Ruksha, Tikshna, Ushna and Vishada Gunas, which are opposite to Nidana of Sthaulya, which are causing Sthaulya. So, as per different studies, Rukshana has been found very effective in obesity. And according to the studies, different studies, Rukshana shows its effect on hypoglycemia and dyslipidemia also. And the conclusion is, mainly Ayurveda says two types of diseases, Santarpanajanya and Apatarpanajanya. In Santarpanajanya Vyadis, we adopt for Apatarpana Chikitsa. One among them is Rukshana. And here we are taking Udvartana, which can be effectively used in different lifestyle disorders such as obesity, dyslipidemia, especially for reduction of fat. And Lekhanavasti, because of Ruksha, Ushna, Tikshna Gunas, by virtue of their action causes Dosha Vilayana and Shodhana, which helps in increasing Agni and digestion of Ama and corrects Medo Dhatvagni. And in that Madhu causes Chedana and Rukshana, so it may helpful to reduce the obesity and further serious problems. Thank you.
Timely completion. Our next presenter.
Good afternoon. Hello. Good afternoon, one and all. I, Dr. Tarannum Khan, from PG Department of Molejat, that is General Medicine, Government Nizamiya Tibbi College, Charminar. So I am here to present on concept and management of ischemic heart disease in Unani system. So, shall I continue? Yes. So what is ischemic heart disease? Ischemic heart disease is a condition where there is inadequate blood supply to the heart, or there is increased demand of oxygen to the heart tissues. The prevalence of the disease is approximately 2% of world's population, that is 1.72% of world's population is affected with IHD every year, and according to 2020 census, the 9 million people died because of IHD in 2020, where men are more affected than females. So, the etiology of the disease, as I said in the definition, ischemic heart disease may be when there is inadequate supply of blood or when there is increased oxygen demand. So the condition where there is increased oxygen demand are left and right ventricular hypertrophy, left and right bundle branch block, thyrotoxicosis, tachycardia, and where the condition where there is inadequate supply of blood, like athyroma. 90% of cause is athyroma, the blockage in the blood vessel, which leads to inadequate supply of blood to the heart tissues. And other than that, we have this mitral stenosis, aortic stenosis, carbon monoxide poisonings, and other. So, yes, ischemic heart disease is classified into 4 types. Angina, where there is pain or discomfort in the chest, and the other one is myocardial infarction, where there is infarction of the myocardium muscle. The infarction may be in the partial thickness or maybe in the complete thickness of the myocardium. Chronic ischemic heart disease, it is mostly seen in elderly people with progressive IHD, and the other type is sudden cardiac death. It is when the person dies within 24 hours after the onset of cardiac symptoms, then there occurs sudden cardiac death. Now, this is a concept or pathophysiology in Unani system of medicine. So, in Unani literature, it is said for any disease to occur, there must be following 3 changes: Sue mizaj, Sue tarkib, and tafarruqo ittisal. We'll go in the detail. The first one, Sue mizaj, which means altered temperament. So, according to the fundamentals of Unani, every body has its own temperament called mizaj. So, as everybody has its own temperament, every organ also has its own temperament, and in the same way, every blood vessel, cells, every body part has its own temperament. In the same way, the blood vessels also have their own temperament. So, due to any etiological reason or predisposing factor, like if you take an example of hyperlipidemia, so when there in the case of hyperlipidemia, there is lipid infiltration in the blood vessels. Okay. Now this lipid infiltration, this changes the mizaj, the temperament of the blood vessel, and there occurs the deposition of the fatty streaks. So in the first point, we are seeing there is deposition of fatty streaks due to altered temperament of the blood vessel. Now second one is Sue tarkib. Next slide. Sue tarkib is structural malformation. So after the infiltration of lipid into the blood vessels, there is aggregation, there is infiltration of the macrophages in the blood vessels, foam cells, and the formation of fibrous capsule. Now this fibrous capsule, in the blood vessel we have 3 layers, right? Now this fibrous capsule, the formation of the fibrous capsule in the blood vessel, this outstretches the tunica intima. We have picture on the slide. On the right side we have a normal blood vessel, on the other side we have an abnormal blood vessel having outstretching of the tunica intima. So this Sue tarkib, that is structural malformation. This fibrous capsule, formation of the fibrous capsule followed by change in the temperament is nothing but formation of athyroma. So here in the Sue tarkib, due to structural deformation, we have formation of athyroma. Now this fibrous capsule may be thick or thin. The thick fibrous capsule, we call it as stable athyromas. If the fibrous capsule is thin, then we call it as unstable athyromas. One slide is missed here, I'll tell you orally. After Sue mizaj and Sue tarkib, that is change in alter temperament, and after the change in the structure, normal structure, we have third point, there is rupture of the tunica. Due to the overstretching of the tunica intima, the blood vessel, the tunica intima ruptures over there, and this is called tafarruqo ittisal, that is break in the continuity. Due to overstretching of the tunica intima, the blood vessel is ruptured, and followed by rupturing of the blood vessel, there is aggregation of the platelets, adhesion of the platelets, and then there is a formation of clot. Clot in the pathway of the blood vessel is nothing but obstruction. Obstruction in Unani medicine is referred as Suddha. So due to this obstruction or Suddha in the pathway of the blood vessel, there is inadequate supply of the blood to the heart tissue, and this leads to ischemia and followed by infarction. So this is what the Unani literature says in past times. What today modern science is saying is the first point, as I said, there is initiation with deposition of foam cells and formation of fatty streaks. As I said, due to altered temperament of the blood vessel, the fatty streaks are initiated over there. Then there is structural deformity, that is formation of atheroma. And third, there is rupture of blood vessel due to outstretching, that is tafarruqo ittisal. And then there is aggregation and adhesion of the platelets forming the clot, the obstruction, nothing but Suddha. So this is what said very past times, and now we have we are discovering it and we are learning our modern books. The other point is, yes, we know the clinical signs of the disease. This is the classical sign of ischemic heart disease called Levine sign. Chest pain, where the person he makes his fist and he presses it over the sternal area. And this pain radiates to left arm, left neck, left shoulder, left hand. This is the classical sign called Levine sign. Other associated symptoms are dyspnea, diaphoresis, hypotension or hypertension, epigastric pain, and nausea. Yes, next. Investigations for the disease are, apart from routine investigation for ischemic heart disease, we check ECGs, X-rays, and yes, cardiac markers, 2D echo, myocardial perfusion scintigraphy, stress test, and of course, angiogram. Now comes the management part, the treatment. The treatment in Unani system has 4 modalities: Ilaj bil Ghiza, dietotherapy; Ilaj bil Tadbir, regimen therapy; Ilaj bil Dawa, pharmacotherapy, where we give the medicine; and Ilaj bil Yad, surgery. So, Ilaj bil Ghiza is diet therapy, where we restrict for few type of diet and foods, and where we ask patient to consume what kind of food to be taken. So naturally we avoid saturated fats and animal origin foods, junk foods and all these things mentioned on the slide, dairy products and all. And food to be consumed are soya bean, low fat milk, unsaturated fats and jaggery, organic and fresh fruit, vegetables, etc. Next, Ilaj bil Tadbir, that is regimens to be done are like exercises to be done, and like brisk walking recommended by WHO nowadays. And apart from that, exercises and dalak, massage, shamum, inhalation, and fasad, of course, venesection, phlebotomy. Next slide. Treatment with drug. Treatment with drug in pharmacy in this Unani system is given in 2 ways. Either the single drug is given or the compound drug is made. So single drugs are given as cardiotonic, accelerant, yes, mufarre adviya are like accelerants, and muqawwiyat qalb, cardiotonics, and mufattit sudat, mane tashanum, and like antipalpitory drugs, and deobstruent, and yes, cardiotonic as I told, antilipid medicines. So these are the list of drugs, like single drugs, and murakkab adviya are like compound drugs, like this one, mufarre sheikhur rais, Khamire Marwarid, Majune Ushba, Dawaul Misk Mu'tadil, and Majune Seed. Surgery. Okay. So surgery, surgery is like angiography and CABG is performed in ischemic heart disease. In CABG, coronary artery bypass grafting, we use either the artery grafts or the veins as a graft. The complication of the diseases are pericarditis. Next slide, please. Pericarditis. These are the list of complications of the disease, and prognosis is bad in the cases of advanced age, uncontrolled diabetes or hypertension, addictives of alcohol, smoking, and etc. And good prognosis is when the patient is treated in appropriate time with appropriate medicine. Thank you. Yes, ma'am.
To one and all present here, I'm Dr. Bashira, PG Scholar from Government Nizamiya Unani Medical College, Charminar, Hyderabad. I thank my guide, Professor Syed Khader Hussaini sir, and HOD, Dr. Muhammad Ehsan Farooqi sir. So my topic, I'm going to present here today, the topic is concept of Khuba tinea cruris and its management in Unani system of medicine. Next slide. Here there is some script written in Urdu, Arabic and Farsi. Please. By the eminent Unani physicians like Zikriya Razi and Al-Hawi. Please continue. I'm just going to correlate it with the modern concept, the Unani concept. Please continue. Move on to the slides or not. Slides. I just apologize as my PPT is not properly. So as you have seen some manuscripts and some present scripts written in Urdu, Arabic and Farsi by the eminent Unani physicians. So I would like to correlate that with the concept, allopathic concept, the allopathy. That is, they state, the Unani physicians state, whenever there is more moisture, fungal growth or organisms attract. Acute changes leads to pruritus. As per the temperament of Sauda, as my friend Dr. Taranum has told that we deal with the temperament. Every body, every part has its own temperament, and the human being has the 4 humoral theory, that is blood, the bile, safra, Sauda and balgam. So this disease is totally because of Sauda, that is the burnt black bile. So that this Sauda leads to dryness that develops, which favors the growth organism that is called fungal dermatophyte.
Excuse me, please keep quiet.
So moving on to the tinea cruris, that is Huba, the introduction in the 16 AD, Galen of Pergamum, Rabban Tabri, he is a Unani physician. In Firdos al-Hikmat, he has written a book called Firdos al-Hikmat, the legendary physician Zikriya Razi, and Najibuddin Samarkandi, in Shari Asbab, that is Al-Khanun fi Tib, that is the Avisana, and Hassan bil Rabban Tabri, Ghina wa Munna. These are the eminent Unani books written by eminent Unani scholars. They all state that the cause of tinea cruris, that is Huba, ringworm, probably is due to altered defensive mechanism of the skin. Spread of fungal infection should not be beyond the epidermis. In 1st century AD, Christopher Celsus described it as carrion in the treatise De Medicina, and a historical note on the evolutionary ringworm by ancient literature reveals that ringworm in humans is considered as an early evidence noted in the 2nd century BC, which is termed as Dhadru in Charaka Samhita. When moving in 600 BC, Shushruta and Vagbhata, 6th century AD, mentioned Dhadru as Mahakushta. And the Bower manuscript says that in 3rd and 4th century, mentions various remedies for ringworm, Huba, that is tinea cruris. Physicians have been very aware of superficial fungal infections for centuries, and the treatment of fungal infections remained unknown till 1800s. Among the relevant researchers in the field of superficial mycosis, Robert Hooke was the first scientist to discover the fungal character of dermatophytosis. And later on, Scully, and next David Grubre, he isolated fungus, and Saveron, he designed a culture medium for it. The current classification of dermatophytosis was published by Emmons. This led to the discovery of several species of dermatophytes in the first decade of 20th century. Next, now I would like to explain you the concept of tinea in modern medicine, that is modern pathy. Tinea is a skin disease caused by fungal infection of the keratinized structures known as dermatophytosis, which is a chronic superficial mycosis, and the organisms causing them are known as dermatophytes. It is an asymmetric lesion, non-systematic disease, well-defined, roundish, scaly, inflamed area with papillovascular, and it is localized. The skin appears annular, ring-like structure. Tinea cruris, the synonyms are dhobi itch and jock itch. It is very common dermatophyte infection, which involves groin, genitals, and skin of pubic, perineal, and perianal areas. Autoinfection of dermatophytosis is possible, and it is very crucial in tinea cruris as it occurs as foot to groin infection that spreads all over. The most common etiological agent for tinea cruris is Trichophyton rubrum. Next, moving on to the concept of Huba, that is ringworm tinea cruris in Unani medicine. According to the Unani physicians in the ancient literature, they say that Huba is a type of roughness, that is dryness, that is sauda, and that occurs on the surface of the skin, which is associated with itching, scaling, and dryness. The color of the skin is blackish and reddish. It is a contagious skin disease due to the special madda. That madda is nothing but the fungal dermatophyte. That is called tinea cruris. It spreads all over the body, and generally it occurs on the parts of the body, that is the neck, body, trunk, back, groins, and buttocks, especially the exposed areas and the folded areas, that is the creases, skin creases. Next is the incidence and the prevalence. Cutaneous mycosis, including tinea cruris, affects 20 to 25% of the world's population. As the worldwide increases in the occurrence of dermatophytosis, and the discovery of recalcitrant infections have caused global concern. Moving into the causes of tinea cruris, that is Huba, in Unani system of medicine. Unani medicine is based on the humoral theory. The Unani physicians have shown the direction towards the changes of the humors, that is called Khilti Mawad. That is the Hiddate Hun, that is the intensity in the blood. Increasing heat, the temperature of heat increases in the blood. Then Burukhiyat of Balgam, that is the saltiness of the phlegm. Next, Ehterahe Hun, that is the burnt blood into ash. And next, the Saudawiyat, that is the burnt bile in the blood. And it is a contagious disease that is transmitted by fomites. And contaminated towels, the hotel rooms, bed sheets, auto-inoculation from a reservoir on the hands and feet. Example, you have the tinea manum, tinea pedis, and tinea unguium. Risk factors initially, that is mainly the reinfection occurs because of the tight-fitting clothes and wet clothing and undergarments. The pathogenesis based on the Unani system of medicine about the tinea cruris, that is the Huba. Here, I would like to explain the pathogenesis in Unani concept, correlating it. Altered humor of blood and sauda was stated in ancient literature. As per pathophysiology of Unani system of medicine, changes in the medicine in this condition probably is due to the altered immune deficiency mechanism of the local tissue. A simplified explanation of the complex and not well-known etiology. Pathological changes just like keratosis may occur due to autosomal dominant gene and environmental trauma. Moving on to the clinical features. It is characterized with the first appearance of small dots, that is reddish in color, defined lesion, itching lesions in the groin, and itching in the groin is predominant complaint. Groin show red plaques, well-defined margins, related to the parts of thigh and buttocks. It should be differentiated from candidiasis. Moving on to the differential diagnosis, it can be differentiated from candidiasis, which does not have any distinct raised margins. It is also differentiated from irritant contact dermatitis, which has mild edema. And it should be differentiated from folliculitis and has a central hair pustules. Moving on to the investigations, the routine investigations and the specific investigation is the culture test and the KOH examination. And based on the principles of Unani system of treatment, the principle of treatment of Unani medicine in Huba, that is tinea cruris ringworm, is Musafiyat, blood purifiers, and Saudeka tanghia, that is the antifungals, and external application, and the diet, Ghiza, which has to be avoided. Saudeka Ghiza, that is like the brinjal, you have the sun hemp, or you say the gongura, normally in Telugu, and then you can avoid all the like mirchi, the chilies, example. And next, moving on to the treatment, especially in Unani system of medicine, that is, we can give Nagande babari, which is Osimum basilicum, which is a species of Osimum. It's also a tulasi, Osimum basilicum. Nagande babari, that's decoction of Nagande babari, single drug. And topical application, for application you can give this Rogane badam talc and powder of Rogane badam talc with lemon. It can be given in topical application. These are the both antifungals that is given in the treatment of Unani medication. Thank you one and all and the dignitaries for giving me this opportunity to present here. Thank you.
My topic of poster presentation was efficacy of bowel nosodes in altered microbiota gut-brain axis. So this is something new concept where the microbiota means the normal intestinal flora which we have in our gut. So there is a, next slide please. So there is a bidirectional connection between our gut and brain. So what happens, see, today we are using excess of pesticides. So approximately 2 million tons of pesticides are utilized annually worldwide. However, in 2020, see that it is around 3.5 million tons. So because of, next slide please. So in India also, see, the around, it is 2014 and 2015, the data shows 54,121 million tons of these pesticides. So this excess of usage of pesticides, actually see 75% of non-organic fresh products that are sold in market contain residues of these potentially harmful pesticides. So these pesticides are entered our food chain also. So even the the examples I have quoted, the high pesticide residue scores for apple, blueberries, grapes.
Audience, please keep quiet. He is presenting, please.
And also, see, nowadays people are consuming more soft drinks. Even the soft drinks were showing the residues of pesticides. So next slide please. So the commonly found, next slide. So next slide. So this microbiota gut-brain axis, actually it is a mutualistic relationship between the brain and the gut microbiota, which is essential for maintaining the healthy mental state of a host, including brain function. See, indeed, the gut microbiota and central nervous system communicate bidirectionally via microbiota gut-brain axis. So, in fact, the exposure to the pesticides have shown to disrupt this gut microbiota composition while being found to have negative impact on cognitive process in humans, that is anxiety, memory and social interaction. So, this microbiota gut-brain axis plays a key role in neurodevelopment. Consequently, it is possible to consider that microbiome, and particularly in the early life events, that is the initial colonization and the microbiota development, can determine the general and mental health in later life. So, which has risk for developing autism spectrum disorder and schizophrenia. Next slide. So, in homeopathy, actually we have bowel nosodes. So bowel nosodes, where we use this pathological product or diseased product to make medicines. So we have taken these medicines and we have experimented even in our OPs, where we give the medicines to the patients, where they have these symptoms of IBS, all those things. After giving our medications, there was good improvement. So the last slide. Next. So a study reported that 69.6% of dysbiotic Japanese patients taking the bowel nosode showed improvement and no harmful effects were reported in any patient. So they conducted a study also in Japan where these homeo medications are given, these bowel nosodes, and their gut microbiota flora was normalized. Actually, because of this abnormal gut flora, so and even in schizophrenic patient, we frequently patient complaints about related to GIT symptoms, that is diarrhea, maybe constipation, some other thing. Even the IBS patients frequently found to have these disorders of mood, that is depression, anxiety. So somewhere this gut and our brain is connected, and this flora will playing a crucial role. So this is the area where we have some medication in homeopathy and we are getting good results. So thank you, Vanessa.
Thank you. If it runs, okay. Otherwise, you need to present on a hard copy. Is that okay? Is not
Department of Panchkarma and HOD. Do herself. Back. Previous. Next. Arshana, and is subdivided into Avapida and Pradhamana. Okay. Snehana is subdivided into Marsha, physician through his mouth into the nostrils of the patient with the help of tubes which are 6 angulas. After the morbid matter is eliminated from the head of the patient, Physician should make him drink water and give him food which is easily digestible. Patient is made to stay in house free from bees. Next, please. Two methods are used. First method is 6 inches tube, as I said earlier, is used. Fine powder of serovirginal drugs are used, and dosage is 3 muchiti. Next, please. It is image of Pradhamana is administered in by tribals. Next, please. Images you can have. Next, please. Modern practice. Next. The second method is according to Videha, 1 sukti of powder is kept in potally of thin cloth and patient is asked to inhale deeply so that medicine enters into the nostrils. Uses it expels doshas in more quantities. Next, please. It is a modified method and you can see the image. Next, please. Indications. It is reference is Sharangadara. Those suffering from Chetovikara, that is mental disorders, Krimi, Visha and Utkata doshas, Visanjana can be used. Next, please. Dosage is, as I said earlier, Muchiti Matra. Next, please. Pinch of powder is used, Kola Pramana by Pava Prakasha. I'm saying that. General drugs used are Katfala Churna, Trikatu Churna, Katutumbi Churna, Pippali, Vidanga, Kshavaka, Maricha, Shigru, Panijika. Tikshna drugs are rock salt, garlic, Gugulu, Maricha and Vidanga. Next, please. It is the image of Trikatu Churna. Next, please. Yes. It is reference from Charaka. Marichadi Pradhamnanasya used in Shiroroga, Nasaroga, Akshiroga, Katfala Churna in insomnia, Vacha Churna in Apasmara, Apamarga Tandulia in Pratishaya, Krimi and Kafaroga. Thank you.
Okay. We'll do here felicitation of our dignitaries and our presenters also. So don't leave hall. All presenters should be here next 5 minutes. So first, I would like to call upon Rajeshri ma'am to felicitate our keynote speaker, Anurag Pandey sir. Ma'am, please. Yes. Next is Dr. Mamta Pandey Sarji. They both came from BHU to present here in Hyderabad. Thank you, ma'am. She has presented Rukshan management in the obesity. Next is Tarunam Khan, Unani Medicines. Thank you, Tarunam. And thank you, Bashira. And our last presenter from homeopathy, Arun Kumar. Rajeshwar Rao sir's student, he is. Give him a big applause. Thank you, sir. Thank you very much. Here 2 minutes, sir. Only 2 minutes.
Actually, today the topics are very interested topics and most burning problems, and the participants are from different streams. So Ayurvedic, Unani, Homeo, and it is very difficult to judge on my part, being a homeopath. And of course, some of them are very good in presentation, some of them are good in subject relevance, and so we have to calculate all the things and some time management and everything and expression. So all are good, but it is very difficult to judge on our part really. So don't think otherwise if only one is selected, because there is only one chance, but all of you will be given participant. So we will decide and tell who is the winner.
Sir, we declare the winner, but they will get the prize in the valedictory session only on the Sunday.
Madam, excuse me, Madam. వద్దు అదే చెప్దాం ఓన్లీ బికాస్ I think in this one subject relevance she is good describing is good but subject relevance more of So the Dr. Manisha has been selected. So basing on different factors, okay, don't think otherwise for other people. So it's very difficult to judge, but we finally selected Dr. Manisha, okay.
Our program is over, so we can continue with our next session. Thank you all of you. Thank you our dignitaries. Thank you all senior people here, and thank you all students here. Thank you.